start with the thyroid gland, its function, its anatomy. It's a little gland, a little butterfly gland that sits right at the bottom of the neck. And the pituitary gland secretes a hormone called thyroid stimulating hormone. And when that goes up, then it stimulates the thyroid to produce and release more of the thyroid hormone. There are two thyroid hormones. Well, we'll take that one step back. The pituitary is under the control of the hypothalamus. So there's a thyroid releasing hormone coming from the hypothalamus, sending a message to the pituitary whether to upregulate or downregulate the amount of thyroid hormone that is produced. There are two thyroid hormones. We call them T3 and T4. These two thyroid hormones are, like I say, are under the control of the pituitary gland. They function like a thermostat. The higher the levels of the T3 and T4 in the bloodstream, then there's less stimulation, or the TSH from the pituitary will go down, so there's less stimulus for production and release. 80% of the hormone that is released from the thyroid gland is what we call T4. That 4 and the 3 refer to how many iodine units are on the thyroid hormone. So T4 has 4 iodine units and T3 has 3 iodine units on it. T4 is about a fourth as active as T3. So from my standpoint, the T3 is the most important hormone that's in our body. It's the most active, 4 times more active, and it has 10 times more affinity for the thyroid hormone sites in the body. So the T4 is not a good indicator of what's going on from a thyroid hormone functioning standpoint. Now, what does those two hormones, or really T3, what do they do in the body? The uptake of all the nutrients in the body is related to how the thyroid hormone levels. If the thyroid hormone is low, nutrients are not broken down, not absorbed as well, and now we have cells in the body that don't have the nutrients they need. It does normalize insulin levels. So it does have some things to do with glucose and insulin metabolism. It increases the uptake of glucose so that energy can be utilized. As energy is utilized, because the thyroid hormone is a metabolic hormone, increasing the energy needs of the body, then it has to reduce the glucose that's in the body itself. It also increases the breakdown of fat into energy. Increase oxygen consumption, so that the sodium-potassium pumps and calcium-magnesium pumps that are in the cell membrane wall to keep those minerals and those electrolytes in proper balance so the cells can function is to a certain extent under the control of the thyroid gland. It does assist in detoxification, which is important, and actually the processing of the estrogens into the safer 2-hydroxy metabolites is utilized or helped through the thyroid gland. When it's lower, when thyroid hormones are low, then there's more of the 4-hydroxy and the 16-hydroxy, which are the metabolites of estrogen, which are more cancer-inducing in the body. It does also improve the flow of liquid or fluid throughout the body, lymph and blood. So you can see that a lot of the thyroid functioning has to do with how we look, how we feel. From a weight standpoint, if the fluid is moving well, if the lymphatics are moving well, then there's not going to be as much congestion in tissue present in the body. And if the thyroid is working like it should, the burning of energy, the burning of glucose, the burning of fat for energy purposes is also going to then reduce some of the fat in our body. It does upregulate the beta receptors. The beta receptors are throughout our body, especially in the bloodstream, and has to do with blood pressure regulation. Now, one of the things that happens when a child is born is they prick the finger for some blood. That is to check the thyroid of a newborn baby, because in childhood and in newborns, the thyroid is absolutely critical for the development of the brain. In hypothyroidism, if it's not picked up at birth and there's a problem, then there is going to be a brain development loss, brain IQ will be down, learning disabilities, probably behavioral disabilities will also be there, so that the thyroid is important for the growth of the nerve cells and the fat that surrounds the nerve cells. All of that is under the control, to a certain extent, of the thyroid gland.